Thank you not only for inviting me today, but for the huge work that was done with this survey and this study. And I want to thank because it will be very useful for an activity I am following now, and I will speak a little bit later on that. Exactly 10 years ago, the Commission mandated by WHO on public health, innovation and intellectual property right was focused on transmissible disease, was focused on the problem of the poor in the poor country, and was not tackling with the whole range and spectrum of public health worldwide. Now I am co-chairing a commission mandated by the General Secretary of the UN with more or less the similar name, but with another aim. We are now really confronted with the problem not only of the north-south divide, not only on the tropical disease or the communicable disease, but also on the non-communicable disease, because we are aware that it is the greater load on the public health system in the world. And we are not only in charge with looking how to promote innovation and access of medicine, but also diagnostic and devices and vaccine, but this is not the case here in the issue of diabetes. Medicine is one thing. Diagnostic is as important in the case of diagnostic as medicine, if I can say so. We had a hearing 2 weeks ago, I think, in Johannesburg, where a lady who is suffering from diabetes form 1, who said for her the possibility to test exactly the sugar in the blood is as important as receiving the medicine, and there is always breaks in the possibility for her to have the diagnostic. The device is also very important in this issue, because, as you have heard, it is not only the medicine that is sold by the company who are now the dominant company in the world, but the way the medicine is brought to the bodies of the patients, and the devices make it now make an obstacle to the accessibility and to the price of the medicine. So I think it's really an example about the link between the different elements of a health system. If I add all the other things, the procurement, the system of delivery in the country. So it's really the model, I would say, that is interesting for the work we are doing now in this commission, and in this sense, I have to thank you for the elements and the data you bring to us. I am sure we will make as good use as possible from them. Let me just add perhaps two ideas or three. One of them is really that the change from human insulin to analog insulin is a question. Two young girls I am responsible for lived this change also in fear of having not access to the analog insulin in the same way and to the same price as they had before with the human insulin. The second is the importance of R&D. As it was told before, we don't have now the best way to give insulin to the people, and I think we don't have the best insulin or the cheapest that gives the value that we need. So let me just finish with one sentence. What for me is very important in the story of this disease is the empowerment of the patients. I mean, it is one of the disease where chronic disease where really the patient is master about his illness, is able to diagnostic if he needs the insulin or not, or to to measure exactly. And this empowerment of the patient is something I think that is also a model for other chronic disease and very important. But the empowerment of the states, the empowerment of the medical system who has to provide this is far not so developed as the empowerment of the patient themselves, and the accountability problem Hans raised is, in my view, perhaps the most important. Thank you.